What if you could take that risk, make that change, reach that goal, live your best life? Welcome to another episode of the What If You Could podcast, where we get together with amazing experts and everyday people who share challenges, encourage healing, and explore the possibilities that life has to offer. I'm your host, Gary Scott, and I'm excited that you're along for the ride. Hey, everybody. Welcome to another episode of the What If You Could podcast. And today I've got a really awesome guest. We're going to talk about something I've never really heard of, and he's going to share his story with us. So, welcome, Brett Cordis. Thank you so much.
Thanks, Gary. I appreciate it. I'm happy to be here.
Yeah. Well, I'm going to read your bio, and then we'll just get going, and we'll hear about what you've got cooking. So, everybody, I've got Brett Cordis is a recently retired ear, nose, and throat physician and surgeon who is now launching his own private physician coaching business. Brett's career was almost completely derailed as he battled the disease of addiction. However, through consistent hard work founded in humility, he was able to rejoin the career that he has always loved and is now coaching physicians with symptoms of burnout and substance abuse. And so, what an awesome topic. I mean, I know that's almost completely taboo, right, to talk about this kind of thing, but so I'm excited to get into it with you.
Yeah, absolutely. It was really part of a almost 180-degree career pivot for me. I was a traditional physician, so to speak, treating patients in clinic and, operating when necessary. But after 15 years of working, I kind of burned out on clinical medicine and really had no plans or idea of what was coming next, what was going to be my next chapter in life. Um, and really it was just fate that brought life coaching into my life. And then I've kind of tailored that to coach just physicians who are experiencing symptoms of burnout, which may or may not include substance abuse. But yeah, talk about taboo. Really anything that makes a physician or surgeon human, so to speak, is taboo, which is ridiculous when you say it. But people don't want to think of their surgeons as having, a lot of personal problems.
No, there was a movie, I don't remember what it's called, but Alec Baldwin, this just hit me. Alec Baldwin was a surgeon, and they said, you know what? They were interviewing, I think he murdered his wife or something. And they interviewed him, said, God, you just act like you're God. And he goes, I am God. Surgeons have some sort of combat. But before we get too deep into the subject, now I have to ask you the what if you could question because we're the What If You Could podcast. And so I always do ask my guests, Brett, has you ever had a moment where you go, God, what if I could? Or was there a what if you could time in your life that you'd like to share with us before we get started?
Sure. The first thing that comes to mind is when I was a teenager. Well, when I was 19, going on 20. Unfortunately, I had to battle cancer, non-Hodgkin's lymphoma, and it was it was a 16-month ordeal. And toward the end of it, I saw a lot of doctors, a lot of hospitals, a lot of appointments, a lot of late doctors, a lot of short-tempered doctors. And so I was thinking to myself, gosh, if I could be on that side of this medical equation, I'd do it a lot differently. So what if I could be on this other side? And that's literally what caused me to change my major in college and go to medical school. So that was my
Wow.
what if I
So
could moment.
out of the the trauma, I've had cancer for like a lot of friends with cancer last month. It's really, I mean, you hear the C word, it's brutal, but yet what did you want to do before that? What were you in college for before you went to be a doctor?
Well, Gary, to be honest, I didn't know. I was majoring in history just because I enjoyed history. And my father was a dean of one of the colleges at the university, and so he said, you know, made sure I was taking classes that would eventually go to some major. I wasn't just spinning my wheels. But there was no medical personnel in my family. There were no nurses, there were no doctors, there were no physical therapists. It was all engineers and teachers and lawyers. Um, but my
I'm glad you didn't go down that route. I'm glad you took an honest living.
Yeah, but my mom did always say, she always used to say that she thought I'd be a good doctor because I have a good smile. So I remember that. So
Well,
she got her wish.
you look like a doctor. If I was going to make a television show or a movie and I was looking for a young doctor, I would cast you in that role. You look like a young doctor. So I mean that's a good thing. But so that's interesting. So a turn of fate took you from one path to another. Was it you were getting really good care and you go, God, this I could heal people. This is amazing, or was it like, I think there's something missing here in in this care, and I could maybe add to that?
Yeah, it was the latter, to be honest with you. So I was living at the time. I was born and raised in Baton Rouge, Louisiana, and so the lymphoma that I had, non-Hodgkin's lymphoma, is not uncommon. So the treatment protocols are pretty established. But my parents brought me to MD Anderson in Houston to have a
Mm,
second opinion, which is one of the greatest institutions for cancer in the world.
yeah.
And they agreed that everything in Baton Rouge that we were going to do was appropriate. But what I did notice about MD Anderson is that I felt like I was treated like just a number. Um, and so, like you were saying, it was really wow. I wish I could improve on some of the bedside manners that I've been exposed to. But at the time, and I still feel this way, and I've sent patients to MD Anderson and told them to expect this, which is the following: um, I didn't have a problem trading a great bedside manner for world class care. But another what if you could moment, which is what if you could do both? What if I could provide world class care and a nice bedside manner?
Yeah, when when my wife got cancer, I just felt that they just like were like they just went to the shelf, they pulled out Cancer for Dummies, they went to stomach cancer and said, "Oh, we're just gonna do this, and you're gonna be on that treadmill of that. Okay, see you later. Get your stent. I mean, get your port, get your this, do that, blah 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 blah." And it was really frustrating. I kept asking them, "Please, let's try somewhere else." But when I got my cancer, I was so impressed with my team. Um, I'll even shout out, "Hey, Kaiser." I was really impressed with my team. Boy, not only did they really, really care, I just loved my team, but man, they were just so on it. I just felt really good. So you can do both. You can do both for sure. But so you didn't go into oncology, you didn't go into cancer. How did you select ear, nose, and throat from that experience with the cancer?
Well, you know, the subcategory of ear, nose, and throat, which is technically known as otolaryngology, is head and neck surgery. So we do surgery on anything above the clavicles, not including the brain. So there is an awful
What is
lot
it?
of
What is a clavicle?
collarbone. I'm sorry.
Okay, that's just so the rest of us know. 'Cause I'm thinking, how high is that? Okay, I'm sorry. Go ahead.
Yeah. So so with head and neck surgery, you have throat cancer, oral cavity cancer, and so there is some cancer. But you're right, I was not drawn to oncology specifically. So what I was drawn to, and this is the case for many medical students, is the first thing I was drawn to was just the personality of the people in ENT surgery. Um, they're a little bit of a what I would term a work hard, play hard group, which seemed to match my personality almost perfectly. So that was the main thing. I liked hanging out with the guys and girls on Friday afternoon after a week's work.
Yeah. Well, it's funny because I had, or not funny, but I mean, I had throat cancer, and luckily it was HPV, so it's a little bit different kind of cancer. And I found it super early because I'm triple anal weird about my health. So it's like I found it immediately and beat everybody up to biopsy it. But man, I walked in and I had this young surgeon at Kaiser, and I was obviously terrified because I didn't know what the cancer was yet. And and my surgeon. He was so awesome. He's like, dude, relax. He goes, I know exactly what you have. I know exactly what I've got to do. I'm going to walk you through it. and you're going to live to be 100 years old. He goes, I completely got this. And he goes, it's going to suck. He goes, you will never know pain like what I'm going to put you through when I remove all your stuff. He goes, you, but big deal, right? You're going to live. And he was awesome. His surgeon was so, like you said, he was a little bit different than the first surgeon I met, who was an older guy who was a little bit more different.
Yeah. Well, you probably didn't know, but that was almost certainly an ear, nose, and throat surgeon that
Yes,
that
he
that
was
talked you through
absolutely.
that.
No, he was totally an ear, nose, and throat surgeon. That's all he did. And all he did was I mean, pretty much HPV cancer. And he just went, I'm going to tear out your tonsils. I'm going to tear out your tongue. I'm going to rip up your throat. He goes, this is going to hurt like a mofo. You're going to be hating life for 2 weeks, right? And he goes, but take the drugs. Just do what I tell you to do. And it was amazing. I remember he called me a week after the surgery and I saw his number and I go, Doc, how are you? He goes, can I talk to Gary, please? I go, this is Gary. He goes, dude, how are you? It's only been a week, right? And I'm like, man, you were awesome. Whatever you did, I mean, I was really in pain, but I wasn't like I felt I just felt good, like I knew he had done his job. But yeah, he was great. So you're right. You guys, you ear, nose, and throat guys are good.
Well, I'm glad you had a good experience.
Very good experience. So, how long did you do? How long were you? Because it takes a long time to be a doctor, right? I mean, how long did it take till you started practicing, and where did you go?
Yeah. So the short answer is 13 years after high school. So 4 years. Well, actually, it was 4.5 years for me in college because I had to take some time off. When I was treated for the lymphoma. But 4 years of college, 4 years of medical school, 5 years of residency, which is 1 year of general surgery, and then 4 years of head and neck surgery training. And so, one of the ironic things about my medical training was that I trained at Baylor College of Medicine in Houston, and our head and neck cancer rotations were at MD Anderson. So it was really talk about come full circle to be training in the facility that I was treated at. A decade and a half earlier was really kind of an awesome, in the true sense of the word, an awesome experience. And if I may,
That's amazing. Yeah,
I'll
that's
tell you a
amazing.
little story. Because I mentioned only being the number at MD Anderson. That was saved for one doctor who was my lymphoma physician. And so I'll just tell you his last name is Romagera. Dr. Romagera was fantastic. He was very hands-on, bedside manner was phenomenal. And I don't know if I reminded him of a family member or whatnot, but we just really seemed to gel. And after everything was said and done, had the stem cell transplant. We're 6 months out. I'm cancer free. My dad wrote him a handwritten letter just telling him how much he meant to us as a family. And he wrote back and said, how much it meant to him, and he was going to put the letter in his office. So fast forward 15 years, and now I'm a fourth year head and neck surgical resident at MD Anderson. And I had not seen Dr. Romagera in years and years. And our service was consulted by a service he was working at for a nosebleed in the ICU, which is common for ENT doctors. So I went and took care of the nosebleed in the ICU and went to go call the requesting physician and then recognized his name, Dr. Romagera. So I just walked to his office and walked in his office and said, "Hey, I'm Brett Cordis. I'm the resident taking care of Mrs. So and so. Just want to let you know the nosebleed's taken care of. And I also want to thank you for saving my life." And he looked at me kind of stunned, and he kind of looked at me a little closer, and then he turned and looked at his shelf at my dad's letter that was there,
Uh,
and then turned back. It was I will say there weren't many dry eyes in the room that afternoon. It was
oh
incredible.
man, God, no shit. I got goosebumps all over me just thinking about that. That's, I mean, what are the odds of that? I mean,
Right.
him getting you through and him making that difference in your life, and then you guys end up working in the same place, and you pop in and go, "Hey, doc, remember me?" I mean, that's incredible.
Yeah.
That's really
Yeah.
awesome story. I mean, and when you look. back, I mean, his care, what he did probably, instilled that in you, and I'm sure that's kind of what you were looking to achieve was kind of how he took care of you.
Absolutely. I mean, you're exactly right. I mean, to the T. I remember thinking he made me feel like I was his only patient he was seeing the entire day, which ultimately became my goal as a physician, which is, you know, is hard. That's hard to do. You know, life happens. You've got baseball games and dance recitals to make, and anyway, that's not always easy, but that ended up being my goal.
Well, plus, I mean, the way they've kind of screwed up medicine now, I mean, the how tough it is on doctors now. I mean, literally, if I see my oncologist, because every 6 months I still go in for my oncology, I get my scan, so I have the scan anxiety every 6 months, and then my blood test. I mean, I rarely see my oncologist. I mean, in fact, I was going to see him May 22nd. They just switched it to say, no, you're going to see your PA. So, I mean, if you get a couple minutes with your doctor, that's one thing, but if then that doctor makes that 3, 4, 5 minutes feel like you're the only patient he has, that's a pretty special dude. That's a pretty special doctor right there.
Yeah, and it's a skill just like anything else that well I learned. You know, I kind of thought that was one of those things that you either have or you don't have, but sure enough, it's a skill that for me took some massaging in order to master, so to speak.
Yeah. So it took 175 years to actually get to where you could start working. My niece just actually she's in Texas now. I don't remember. She's in Austin. Don't remember. But yeah, she's a surgeon. She was going to do one thing and now she ended up being an OBGYN. And I'm like, what? You don't even like kids. So yeah, she just finished. God, she bounced all over. I mean, I remember she told me, Uncle G, man, she was in West Virginia doing a residency, and she's like, Uncle G, you don't know anything until you've done graveyard in an emergency room in West Virginia. All right, I'm gonna leave it at that. She's like, dude, you
You
don't
can
know.
imagine.
Yeah, these people will like just shoot at each other just for shits and giggles. It's just the greatest thing. So after you got through all this work to become a doctor and stuff, where did you go? Did you go work at a hospital? You open your own thing, or what did you do?
Yeah, good question. I received my first actual paycheck as a 32-year-old. So it did take a third of my life to get there. But I trained in Houston and I actually started with a group, with a private practice, ear, nose, and throat group inside the Texas Medical Center. So I started working exactly where I trained and where I was treated, prior. Worked there for 10 years and I'm from Louisiana, so we moved back to Louisiana. Worked in Louisiana for a little over a year, and then decided to kind of hang it up, so to speak, on the clinical medicine and give this coaching thing a try.
Nice, nice. Is it Louisiana or is it Louisiana?
I go with Louisiana.
Louisiana. Okay, just checking. I don't know because sometimes I hear. So, what? I know you had a stumble, and I know you had a challenge that popped up during your time as a physician. And like we started with, I mean, it's such a taboo topic. I mean, I have a friend of mine who was a client originally, became a friend, who's an anesthesiologist. And he shared with me there's a lot of challenges for anesthesiologists because they're breathing, this medicine all day as they're giving it to a client to put them under. So we do look at doctors as not humans, right? Like they don't have problems, they don't get tired, they're just there to take care of us. But there's a lot of stress being a doctor in there.
Oh, there sure is. Yeah, and I mean, we have stress, professional stress, just like anybody has stress at the job. But then there's this whole burnout thing, and some of the issues with physician burnout are limited to physicians simply because insurance companies are involved. You know, if you're going to have your house painted, you don't have to deal with a third party and pay them to have someone else paint your house, and then the people you're paying tell the painter how to do their job. So it's a whole bag of worms that most people would just soon not open.
Yeah. So, did you have a little stumble where it was the stress that got to you, or what happened that kind of took you off course here a little bit?
Yeah, so I'll tell the story about how I became an opiate addict. But essentially, when I was going through my cancer treatment, I was exposed to painkillers, opiates, and lymphoma for me was not a painful cancer. But, I would have biopsies and different things where I would need 8 to 10 pain pills to get through. And at the time, I was a freshman in college. I had a girlfriend. Life was good other than the cancer. And so I would take the pain medicine as needed, and I liked it. There was no doubt that I enjoyed the way they made me feel, but it wasn't anything to write home about. It wasn't any sort of euphoric feeling, and I didn't think twice about giving my medicine back to my mom as soon as I wasn't in pain. Never occurred to me to take more than I needed. So fast forward several years, and I started about 5 years into private practice. I started experiencing at the time what I would have described as boredom. So, and I know that sounds weird because I'm working, 60 hours a week, and my week is anything but boring. But really, what I was experiencing was a lack of fulfillment. And I had spent 32 years of my life climbing this mountain, crawling and scraping and sweating and bleeding, and lots of successes, but also lots of failures, climbing this mountain my entire life, such that, my self worth was 100% dependent on external validation. People telling me, good job, making good grades on these exams, winning this award, achieving this. And so I didn't have any inherent self worth. And so 5 years into private practice, and I stopped being told how wonderful I am, so to speak. And that sounds awful, but I needed that to feel good about myself. And so this lack of fulfillment started to creep in, which was a feeling that I did not like. And then one Friday afternoon, nothing special about this day, but it was a Friday afternoon. My typical routine would be to go home, crack open a couple of Bud Light limes, and hang out with my wife at the pool and just kind of kick back and enjoy the coming weekend. But this particular Friday, a drug rep had brought by some hydrocodone based cough medicine samples. So I said, you know what? This is going to be a great idea. Instead of my 2 Bud Light limes this afternoon, I'm going to take one of these cough medicine samples and see how that does. Because I remembered back from my cancer journey that I liked the way they make me feel. But this time was a completely different ballgame. When I took this pain medication, this cough medicine, I did experience this mind blowing euphoria that I had never even come close to experiencing before that. And that decision, that one little decision to open that cough medicine sample, that seemingly uneventful Friday afternoon, kicked off a 6 year progressive history of, full blown um, opiate addiction to painkillers. So,
When did
um,
they start? Was that a common thing, or they were bringing it in because it was a new type of drug they wanted us to hand out to people?
Yeah, it's very common to just
This
get
cough
samples
medicine.
of a. It's sometimes it's a new medication. Sometimes it's a new job. This person is a new drug representative, and they're trying to build their business. And so the doctors they call on, they bring by samples of old medicine. But this in particular was a new medicine on the shelf.
Yeah, that's
Um,
what I meant. So the medicine itself was new because when I had my throat surgery, obviously they gave me pretty hard oxy, right? And
mhm.
yeah, I didn't like the feeling of it. So I got off it, faster than I could, but I've got some friends who had the exact opposite reaction. They were always asking me, "Hey, do you have any of that stuff left?" I'm like, "No." I don't
Yeah,
have any more of it left, you know. So it was a cough medicine with the same oxy effect that the pill would have?
correct,
Wow.
correct. Yeah, and what I describe, it's very hard. It's almost impossible to adequately describe addiction to a non-addict. But with pain medicine, the way I say is roughly a third of people that take pain medicine actively dislike it, so it makes them nauseated or they have itching or whatnot. A third of patients, it works great for their pain, and they say it feels like one or two beers, a little buzz. Again, nice but nothing great. And then a third of patients think it's a phenomenal feeling, like one of their best drunk highs ever. And then about 5% of that third um, get the euphoric, mind blowing sensation that puts you at a real risk of becoming a drug addict.
And I'd imagine the cough syrup kicks in a lot faster, you know. I mean, I didn't really know anything about addiction until I married my new wife, recently married, and she's been 21 years sober from alcohol and meth, and you know, does the AA and all that stuff, and very supportive in it and involved in it and stuff. But through that, I kind of went down the rabbit hole of, all right, well, I want to know, right? I mean, get what I'm getting myself into, and it's a bear. Man, it's a real bitch. I mean, there's a lot of people that don't make it out. So,
Oh yeah.
after 6 years of this, when did you just go, dude, I'm in trouble here. I gotta do something.
Well, I about 4 years into it, I knew, and incredibly, it took 4 years for me to admit to myself that I was having an issue. I was a drug addict essentially. Um, and so I started trying to wean myself off. That didn't work. I could wean myself off and go for a few days, but it never stuck. Um, and so I tried several times. And I was someone who I would self-describe as having a pretty ironclad willpower. But it was no match whatsoever for once this addiction took a hold of me. Um, and sometimes I talk about how I've had basically two terminal diseases, cancer and addiction. And if I had to choose one to go through, I would choose cancer every day of the week and twice on Sunday. The addiction it's just a different game altogether.
Yeah. You know, and the thing about addiction, and I don't want to speak for your family or any of your history, but I know that, you know, addiction affects more than just the addict. You know, I mean, it really can tear down. And cancer is so similar to that because cancer can devastate an entire family. It affects the spouse, the kids, your job, your income, your finances, friends. I mean, cancer can really rip apart a lot, but addiction is times 1,000. I mean, addiction's really tough. And then, you know, admitting you're an addict is is tough, right? But there's so much support out there. But admitting you're an addict as a doctor is probably like admitting you just murdered like a school bus full of kids. I mean, how does a doctor go, I need help? I mean, it's it's just it's got to be a lot tougher, isn't it?
Oh yeah, it's a completely different ball game, and you're definitely dealing with a couple of sets of double standards. Like you said, these days, most drug addicts and alcoholics, there's a lot of support out there versus 15, 20 years ago. But that's not the case for physicians. Again, like I had said before, nobody wants to go to a doctor who is a drug addict, whether they're in 5 years of recovery or 20 years of recovery. You just soon choose a physician that doesn't have that problem. And it's the same thing with colleagues. It's really is a taboo thing to experience and to know that someone else is dealing with. So because of that, there's a lot of secrecy involved, and there are what are called physician health programs in most states that you can access, and you can get proper care without the need for that care being made public.
Yeah. You know, when my wife, I know she's told the story 100 times, but a dude in her office, one of her superiors just came to her and said, "Look, you either leave here and go to the program or you just leave here. But you're no longer, you got to go. And, to the point where you stay up smoking meth for 5 days and you show up at work and by day five, you're looking pretty rough, right? You're falling
Right.
asleep at your desk, right? So it was pretty obvious to people there she had a problem. And this guy saved her life. They could have just booted her ass out, but this is, like I said, 22 years ago. So, do they have anything like that, physicians, where you can go in and say, "Hey, I need help, and I don't want something to hit the wall before I get it. I want to come to you first," type of thing.
Yes, it's not very widely known, but again, it's called a PHP or Physician's Health Program. And so the ideal situation is that a physician either self-reports or someone reports them to the Physician's Health Program as opposed to the state medical board.
Yes.
The state medical board, their responsibility is to protect the public. Their responsibility is not to help Dr. Cordes through his opiate addiction, you know. So the idea is to prevent the state medical board from finding out, but also be able to get the proper care and accountability that's involved with getting sober and staying sober with drug testing and mandated AA meetings and whatnot. And I wish I could say that I had an experience similar to your wife, but when my partners found out about my drug habit, they fired me that day, and this was over 5 years ago. Actually, it's 6 years ago now. And since the minute I walked out of my office, I have not talked or texted or communicated with any one of my partners at all since that day. So not, and you know, it was my fault. I take 100% responsibility for that. I put, you know, the business at risk. I put my patients at risk. I put them at risk. And so I definitely understand their feeling on the matter. And they were trying to protect themselves. So I don't harbor any resentment toward them. But at the same time, although I did receive support, it really wasn't from my partners.
Yeah. See, and that's the double-edged sword. You obviously it's like if you're with a group of partners or you work at the hospital. So I knew a couple nurses who was like, if you had to give a patient two pills, you kept one for yourself and you gave one to them. I mean, they were to that point where they were like, I'm keeping one for me. Sorry, bro. But if you're going to seek help when you find that, it's like if that's the response you're going to get is you're just going to get your ass kicked right out the gate. It's like makes it tougher to kind of like I'll try to get myself way through this before I'll ask for help, especially with the medical board and stuff like that. I mean, it just seems you need some support because again, number one, we're human. Number one, you work under crazy stress, and number two, you're on drugs all the time. So it right, it seems like a recipe for disaster, but.
Yep.
But I get your what you're saying about your partners. It's like, look, we've got an established business here, and we just can't have the public think, oh, I can no longer go to those people because I don't trust any of them.
Right.
So I get that too, but it sure makes it tough for people to come forward and try to get help, right?
Yes, it does. It does. And so, you know, that was a major motivating factor in me pivoting to coaching, which, you know, um, there isn't an easy way. There isn't an easy private way for physicians to get help because of the fear of repercussions and the fear of the public or the state medical board finding out. And so, ideally, and you know, doctors are we're kind of a finicky group. We've got a lot of us have some pretty grandiose egos going on, and so as a general rule, physicians are not ones to ask for help, especially surgeons. And so what ends up happening is you'll burn down everything around you before you ask for help. And the very, very, very last thing to go is patient care. And so, again, physicians will burn down their families and their personal uh, responsibilities before they let patient care get affected. And so, once patient care becomes affected, they are really deep into burnout and/or substance abuse.
Yeah, I mean, surgeons, um, and honestly, I've always given the props to surgeon with the God complex. I'm like, dude, you're going to open up my heart. You're going to open up my brain. And you're going to do stuff that a very small percentage of the country can do. Attorneys, on the other hand, are all a bunch of egomaniacs, and they're not worth shit. So I'm sorry. I'll edit that out because I got a bunch of attorneys who are family members. But seriously, their egos are off the hook, and all they do is sue people. But you guys, I mean, like I said, my surgeon was incredible. It's incredible what surgeons do when they get in there. But so I want to talk, but I want to switch real quick because I've never heard of coaching of physicians, and I've never heard of like life coach or training for physicians and help like this. So, where did you? How did you get started on this? Where'd you hear I can go into coaching for physicians?
Yeah, that's a great question. So, as part of my recovery, I personally went to a 3 month rehabilitation hospital or treatment center. After I was fired from my job to get better with the addiction, and part of that treatment was psychotherapy, and specifically cognitive behavioral therapy, learning about you know character strengths, character defects, certain negative thought patterns. And so that was a big part of my recovery. And, I think I was maybe 4 years sober. I was working again in Louisiana. And I was just happening to comment on a friend of mine's Facebook page who was a physician coach. She coaches surgeons, not just burnout, but for leadership skills and whatnot, personal aptitude and whatnot. But my commenting apparently was very similar to her training in life coaching, and so she just asked me, "Hey, where are you coming up with these terms and these thoughts? Because it sounds like you're trained to be a life coach." And I told her personal history of my addiction and the cognitive behavioral therapy that I underwent. And she said, "You'd probably be a good coach." And so that's where that idea was born. And I'm still actually finishing up my formal training in life coaching. But my unique, well, what I'll say, my kind of hybrid style of coaching is both what I can take from my personal experience with cognitive behavioral therapy and kind of meld it with my formal training. And so that's kind of what I use to help docs through burnout.
Is it is it is it going to be a situation where it has to be like a confidential thing? Because I would imagine, I mean, let's face it, everybody has a coach. I'm a real estate broker. I had a coach. I hired a coach before I even sold my first house. I mean, back in 1990, right? I mean, Michael Jordan believes in coach. I mean, everybody should have a coach, right? I don't think there's any downside to it. But with a physician, is it something like, well, I don't want to admit that I'm getting coaching because I'm a surgeon and we don't need shit because we're surgeons. Is it is it tough to when you talk to people about sharing this? Do they look at you like you got four eyeballs and go, "What are you talking about with physician coach?"
Yeah, that's a phenomenal question. The answer is yes. It's a big problem. Thankfully, a physician and especially surgeon, they will open up to another physician and or surgeon. I don't think there's any hope whatsoever that a non-physician could be a good physician coach simply for that reason. But there's just something about saying that I'm experiencing some personal coaching. I'm going to a coach. I utilize a coach as opposed to a therapist or a
Yeah.
counselor. Coaching and therapy, there are differences certainly, but the semantics of it apparently is really a big deal for a lot of professionals. So there is the advantage of not having the counselor or the therapy tag to it. But yeah, it's a very
It,
difficult job to get doctors to admit that they need help and then ask for help.
yeah, there's a real weird because I do some counseling and I did a lot of mentoring and coaching in real estate with new realtors and stuff. So there's an interesting thing between coaching, mentoring, and therapy, right? There's a real, although they're really the same thing. I mean, if you've ever done any sort of mentoring or counseling or coaching, there's so much therapy involved because you're getting people over the hump of something, whether it's a professional athlete um, who needs to mentally get over that hump of something, even though you're at the top of your game, you're a professional athlete, right? They still have that something in their head. So yeah, there's a weird thing between mentoring, counselor, coaching, and therapist. It's a whole different way of approaching it.
Yeah, absolutely. And like I said, coaches aren't therapists, but I would say coaches aren't therapists, but therapists are more similar to coaches than vice versa. And to be real quick and easy, quick and simple about it, therapists and counselors fix their clients' problems, and coaches enable their clients to fix their own problems. That's a very quick way of thinking of it. At least that's the way I explain
Yeah, I like that a lot. I'm going to probably use that. I hope
it.
you didn't trademark that because I'm going to steal it.
Oh,
No,
you're
that's
good.
a really brilliant way to say it. So walk us through without giving away too many secrets if you don't want to. So walk us through how this would work. Because, like I said, I've got a lot of friends who are doctors. I know a lot of doctors, and I love them all. I know they work hard, even under this, with the stupid Medicaid, Medi-Cal, the insurance thing. I mean, I just feel bad for a lot of these doctors now, and a lot of them are like, dude, I don't even want to do this anymore. It's not even that I don't make the money I'd hoped to make, and I got tons of student debt and stuff. It's just the fact of it's just kind of run by something that don't want to be run by, right? So I would imagine your field, I'm sure there's a ton of people you could get if you could reach them. So how would it start? What would you do with a doctor who's facing burnout and just like, I need help?
Yeah. Well, so um, first, burnout, at least for physicians, it's all in your head, mostly. Now, yes, there is more work in a day that sometimes we have the time to do, um, and yes, it can be an actual challenge to deal with insurance companies who are telling you how to practice medicine, but the irritability, the frustration, the anger, the mental exhaustion, that's really how we perceive events going on as opposed to being physically overworked. So my coaching is based on the theory that our thoughts control our emotions and our feelings, and then our emotions and our feelings control our actions or inaction, and that ultimately determines how our day goes. So to answer your question, what I do as a coach is kind of identify um, recurring negative thought patterns that someone has across any scenario in life, whether it's getting up in the morning and brushing your teeth and sitting in traffic versus operating on a stage 4 head and neck cancer. I'm identifying negative thought patterns that lead to negative emotions, anger, irritability, frustration. And then we just kind of massage that thought pattern so that it doesn't automatically equal that negative emotion. And then you do that times 100, or you do that times 1,000, and you're taking little perspective changes and applying it across your entire day. And so put that together and you've got a different life, really. But what you really, all you're doing is changing the way you perceive the same events. You're not changing the events, and it's incredibly effective.
I like that because you're not trying to change someone or tell them they're wrong or they're doing something wrong or something like that. You're just kind of massaging what's really happening and try to just make it more of a jump into reality. Like, dude, I know you're burnout or I know this or that or something, but let's step back from it a little bit and kind of look what's really going on. What's happening with that.
Yeah.
Do you perceive that you'll find some clients that maybe just are done with medicine or want to try a different type of medicine and you kind of have to walk them through that?
Yeah, oh, absolutely. And what can be difficult as a coach is to tell them what to do. Especially if you have someone who you know they have several good years left in them. You know that they're an excellent doctor or an excellent surgeon, and them staying in medicine is going to be, for the improvement and the betterment of hundreds and thousands of patients. You know, I want to convince that person to stay in medicine. But that, as a coach, that's not my job. My job is to make the options clear and obvious, and then the client themselves makes that decision. But it can be frustrating and difficult to stay in my lane, so to speak.
We had a, I won't mention his name because I think he delivered every baby out here where I live. But he was our OBGYN and delivered the baby and both of our sons. And we loved him. I mean, we loved this doctor. And like I said, I mean, I think there was either him or one other doctor that delivered everybody, but this guy pretty much delivered everybody because everyone loved him. And then insurance got so outrageous on his delivering of babies, right? So he just stopped. He said, I'll be your gyno and I'll walk you through it, but I'm not going to deliver babies anymore." We're like, "Doc, that's outrageous. I mean,
Hmm.
raise your prices or do something because I mean, like you said, there are going to be hundreds of babies and parents who won't be able to experience the awesomeness of what you are and what you do, right?" And so something changed about, I think it was like 4 or 5 years where he was out of delivering, where he started delivering babies again. I don't know if he just said, "Screw it, I won't make as much money," or whatever, but he started delivering babies again. And so he went through that stage, right? I mean, he was pretty much just going to leave altogether. He was so frustrated with the system and what was going on with him, what were forcing him into. So, God, like you said, I mean, imagine if he had left and didn't start delivering babies again. I think he delivered babies into his late 60s or early 70s.
Wow.
And that's a good what, 40 years of delivering babies? And
Yeah,
he
that's a lot
he
of
was the
babies.
best. Yeah, that's a lot of babies. So when you meet someone like him and you go, "Doc, I get the insurance thing, I get this, I get that, but man, you're such a gift to these families. We've kind of got to figure out a way to keep you doing it, right?"
Yeah, and I mean, you really almost said the magic words. I'll give you an example of just one example of several things we can do. But a lot of physicians feel like they can't be a great doctor and also a great spouse or also a great parent. And so, and I hear that all the time. I can't do it. I can't do both. I can't do both, be a great doctor and a great parent. So I have to choose. And so my response to that usually, and this is based off my own experience, my response to that is almost anytime I say that I can't do something, what I'm really saying and what really is the case is that I either won't do it or I haven't done it yet. And what that does is that puts the power back in the person. That I'm empowering that person to make the decision that they feel like is out of their hands. But that's just one example of things we can do to help docs see their options more clearly.
Yeah, like I said, I know a lot of doctors. I work for them and with my real estate company and stuff. And doctors are notoriously horrible investors. Just make
Uh,
the worst investing moves. I don't know why that is. And that's another thing. It's like I'm a doctor. I got to trust you guys to help me make the right investments and stuff like that. But like you said, do I do the emergency surgery or do I go to my daughter's recital? Do I go this or that? And you kind of get pulled like that. And it's really tough. There's not a lot of businesses where you get called in to go operate on someone, when you're on call and stuff like that. What about as far as your coaching? Will you involve with substance abuse? Will you touch on that with guys, or you'll leave that to the AA and NA and all that stuff?
yeah, that's a great question. Well, certainly substance use as opposed to abuse. Substance use is very common in burnout. And of course, you can be a substance user. You can even be a heavy substance user and not be a substance abuser.
Mm.
But if I determine that someone is a substance abuser, I can talk about my own experience, but that's an example of something that I'm going to leave to the professionals, and I'll tell them what I did, what worked for me, what didn't work for me, but suggest that they get treatment elsewhere for that specific, particularly if I feel like they're an actual addict or alcoholic. That's not something that me as a coach is trained or comfortable doing.
But that might be something you'd address to bring to their attention to say, hey, this is something we should probably touch on if we're going to move forward because been there, done that, and I see the signs, right? Something like that.
Absolutely. And, again, I try not to give advice, but essentially that's what I'm doing when I tell a client that I'm experiencing exactly what it sounds like you're experiencing. I've been there, done that. This is what I did. This is what worked. This is what did not work. And so I am telling them not necessarily what to do and what not to do, but what is likely to be helpful and what is likely to be unhelpful. And then I have the added experience of being able to guide them through the physician's health program and the state medical board. And do I get a lawyer? Do I not get a lawyer? What are the advantages of having an attorney and stuff that almost getting into the weeds. But because I've been there and experienced some of the downside, some of the darkness of this issue, I can give them some pretty good advice in terms of how to navigate that.
That's so massive because I mean, I would imagine that would be one of the first things people would think about. Like, I need to stop what's going on and I need to get help, but I don't have a clue on what to do. Like an attorney, I would have never thought why you need an attorney, but I mean, to have someone there to say, listen, these are the steps, whether you take them or not, here's been there, done that. Here's my advice as far as what I recommend possibly you should look into, and walking them through those steps is golden because I would imagine it's not a common thing and there's not a lot of places you could go to get that kind of advice for a doctor, right?
That's right. Yeah, there really is none.
Yeah,
None
that's
that I
pretty
can
tough.
think of.
Yeah, and I have a good client. He's become a friend of mine. He's a real prominent heart surgeon out here. And the poor guy, it's just his body's just devastated, right? I mean, he even had to have an apparatus built for some of his surgeries because he's hunched over for hours and hours during open heart surgery, and it really took its toll. And he just won't quit. I mean, he just loves what he does, even though the toll it's taken on his body is incredible. I mean, people don't realize when you're hunched over like that, or you're in this, your hands are tight, your body's tight, you're hunched over this for long periods of time, and it's like, okay, next, wheel in the next one. I mean, there's a lot of physical and mental strain to what a surgeon goes through. So you can
Yep.
imagine relief is, something that the guys and gals would look for.
Yeah, absolutely. And so, at this point, the best we can do is just to, I think most physicians just go on Google and Google, burnout treatment or whatnot, because again, there's so much privacy connected to um, some of the ill-gotten coping mechanisms that some of us turn to when we're burned out. But yeah, the secrecy is a major hurdle, and the lack of the propensity for doctors to ask for help is another hurdle. So hopefully, the idea is to tackle this one doc at a time.
That's why this coaching is so important. So, what is next for Brett Coders? What is next for you? What are you going to move forward with the coaching, with you, and what you're doing? What's, if you don't mind sharing, what's next for you?
Sure. Well, I will tell you what's next for me is to build this coaching business into something that I can be proud of. But what I'm going to do completely different than I did the first half of my life, and certainly my first career choice, is to enjoy the present moment, to be present in the current times. Back when I was climbing that mountain the first time, I was constantly looking in the future. Things are going to be great when I'm getting to medical school. Things are going to be great when I get out of medical school and into residency. But things are really going to be great when I get out of residency and I'm practicing physician. That arrival fallacy where everything's going to be great if this and after that. I completely miss the present times. And so this time around, when I have a day off, when I have 2 days off, I'm enjoying those days because the busy days are coming. I know that those are coming, but I'm not constantly putting myself under pressure and establishing this these next to impossible expectations for myself to launch this business as soon as humanly possible. I'm enjoying the process this time. So that's what's next on life's agenda for me.
That's awesome. But I think you just answered my only other next question. I've only had one question. My last question was going to be if you had a final thought for us or a feeling or something that you wanted to leave us with, what would that be? And I don't know if you just answered it, but if you got another one, let me know. I mean, what would be a final thought that you'd like to leave everybody with before we sign off?
Yeah, well, I'll build off that. Other than enjoying the present, I would say, life gets in the way, and sometimes the right path is obvious, but a lot of times it's not obvious. So if someone is burned out, whether you're a physician or not, if you're burned out in life and you find yourself a little bit confused, my advice would just be to do the next right thing. Whether that's get out of bed and brush your teeth, or whether that's get on the internet and start looking for a job. Whatever it is, the next right thing, and then just build off of that.
Yeah, I love that. I love that. You're awesome. I mean, you're going to do great things. I can see it. And man, I've never heard of physician coaching, and I just think it's such an important thing. Like I said, I believe in coaching with all my heart. I've done it. I've had a coach for as long as I can remember. It's such a crucial thing for anybody. I don't care who you are, Michael Jordan, Muhammad Ali, I don't care who you are. Having someone there as a mentor coach is really important to people. So, are we going to one day be able to call you Dr. Brett Cordis again?
Well, yeah, you can call me that now. Once a doctor, always a doctor. But
That's awesome.
now I'm the burnout doc.
Well, you were the burnout doc, but you're no
Right.
longer the burnout doc, but you're going to help all these burned out doctors. And I know there's a lot of them out there. You're going to help them. So, Doc, how do people reach you? What's the best way under the table, on the down low? What's the best way to reach Dr. Brett Cordis and look into this physician's coaching, look for help, kind of get into your sphere there? What's the best way to do that?
The best way to do that is go to my website, which is theburnoutdoc.com. And you can email me and get in touch with me, and we can talk up. Usually start with a free 30-minute consultation, and then we kind of interview each other, see if we're a good fit, and then go from there.
Theburnoutdoc.com. I
Yes,
love
sir.
it. I
You got
love
it.
Burnoutdoc.com. Well, you've been wonderful, Doc. I mean, I know it's not easy to share. I know, but it's important to share like that. I learned that with my wife with AA and stuff. It's just so important to share and get it out there. But what you're going to do is going to be huge. I mean, like I said about my OBGYN, not mine, my wife's, losing him would have been tragic to so many hundreds of people, babies, husbands, wives. And the fact that he jumped back in was huge. So every doctor that you save, considering we have such a lack, I mean, we're behind the eight ball on doctors. We need more doctors. We need more nurses. So everybody that you can help just helps all of us. So I'm grateful for what you're doing and you telling your story.
Well, I appreciate it. I love being here. Thank you for having me.
You got it, buddy. All right, everybody, please go to theburnoutdoc.com. Talk to Dr. Brett Cordis, and we're just grateful for him sharing his story. And we look forward to you coming back. And after you've been doing it a while and how this is cooking, and let us know how it's going, because I'd really love to hear how your success is going.
All right, we'll do.
You got it. Everybody, thank you so much. We'll see you next time. Thanks, everybody. Thanks again for joining us on another episode of What If You Could podcast. Please subscribe, like, share, and give us any feedback. We'd love to hear it. And remember, if you can dream it, you can do it. See you next time.